Good morning, everyone. Welcome back to the channel. It's been a hot second. It's been a minute. Your boy's been busy with the end of intern year, and so just haven't had time to make any of these videos. But on the bright side, today is actually my very last day of clinical work of intern year. And I'm currently on my advanced heart failure elective block. So I'm taking you guys along with me. I took you guys along with me on the first day of intern year, and it just felt right to take you along with me on the last day of intern year. So just arrived at the hospital and about to go start seeing some patients. I'll pre-round first, see what's been going on, and then start seeing some patients. Alright, so just finished seeing my first patient of the day. I'm gonna go see the second. Okay, so the first consult was for a lady with scleroderma that's led to pulmonary hypertension, and she also has a history of HFrEF, which stands for heart failure with reduced ejection fraction. But that was recovered on what we call GDMT, which is guideline directed medical therapy. So her ejection fraction improved from 30s all the way to the 50s, and this was on the medications. But unfortunately, she got sick, and after getting sick, was transferred over to Penn from a different hospital. And while she was here at Penn, we got a repeat transthoracic echocardiogram. And the echocardiogram showed that her ejection fraction this time around, the ejection fraction had gone down back down again to low 30s. And so the heart failure team was consulted to help with management of her diuretics. And also she was volume overloaded on exam. So that just means her legs were swollen, her stomach was swollen. We also looked at the echo, and it also looked like the right side of her heart was also working less than it was before. So that tells us there's biventricular, so both ventricles are failing. I'm gonna go see her now, and after I see her, I'll see what her physical exam looks like, and then let the team know if they need to give more diuretics or not. So just finished seeing the second patient, and this time around it's a different picture. So this is the gentleman with really bad right-sided heart failure, and the right-sided heart failure is due to worsening of the left-sided heart failure, and all of that is now leading to volume accumulating, mostly in his abdomen. His stomach is very distended, and this is a gentleman that gets a procedure called paracentesis every 2 weeks, which is they go in and they drain fluid from the stomach. You typically see this in patients with liver disease, but in his case it's because of his heart. So he came in with worsening of the swelling in his stomach. He was having difficulties breathing, and so the emergency department team consulted us because he's a patient of ours that we see, or rather not ours, but a heart failure attendant. But hopefully one day I'll be saying mine, like ours, like I'm part of the group. But the heart failure team sees outpatient in clinic. So I just went to see him. He has a lot of fluid on him. So we recommended the team to aggressively diurese him to try and take out at least 2 liters of fluid in a day. And then after that, tomorrow we'll do a paracentesis to drain some fluid from his belly. I expect his breathing to improve, and this was a very straightforward admission, or rather consult. So yeah, that was that one. Okay, so just finished seeing all the consults for the morning. It's actually 12:20 right now, so it's almost time for lunch / noon conference. So I'm going to a noon conference and we get food provided. But I'm going to go to the medicine one, not the cardiology one, just to support my medicine colleagues. But yeah, conference next. Okay, heading to go see a third consult. This is actually a very sick gentleman. Unfortunate scenario though, had a heart attack earlier this year and had to get bypass surgery. After he got the bypass surgery, earlier this month. But afterwards, they put a device called an impeller, and the impeller injured some of his heart valve. Well, one of his major heart valve, the aortic valve. And so because of that, he's been accumulating a lot of fluid because blood is just backing up and the heart's no longer working as well as it should. So the cardiac surgeons consulted us to help with management of his heart failure and removal of the fluid. So I'm gonna go see him now, but we'll most likely have him on a Lasix drip, which is a diuretic drip. And because he's got a lot of lines in, he's in the ICU. So we can actually monitor exactly the pressure on the right side of his heart. So I'll probably titrate the Lasix drip according to how much pressure is on that right side of the heart. I don't want to get him too dry, but at the same time, I don't want to get him too wet. So it's a fine balance, because when you get someone too dry, the heart sees less blood or less volume, it can't pump as much. But when he sees too much, he also overwhelms it. So it's all about finding the right balance. So I'm gonna go see him, see what his physical exam looks like, and then give my recommendations to the surgical team. But yeah, this is consult number 3. I think we have another one at 4th. The fellow might take it, who knows, we'll see.
What doses are in? Yeah, I can't even see what doses are in.
And that is it. It's a wrap. All done for the day. That was the end of my clinical year of intern year, which is, it's kind of bittersweet at the moment because the next time that I'm going to be in the hospital, I'll be a senior. and that means I will have a lot more responsibility. But I'm also pretty confident in how the year has gone, and also pretty confident in the learning that I've had over the year, and also knowing that yes, the beginning of senior year might be tough, but I have grown a lot over the past 12 months as an intern, and I'm excited to see how I continue to grow as a senior. But thank you all for coming along, and I will catch you all on the next one. Again, don't forget to like and subscribe. All right, take care. Bye.